Holy cow, folks, this is an example of how frustrating it is to deal with insurance companies when it comes to trying to get a medication approved for a patient. Now, as an allergist immunologist, I often am prescribing medications called biologics. They are essentially lab grown antibodies that can help deal with various diseases, not just in the field of allergy, but we see this now in autoimmune disease, GI, cancer, etc. And they are fantastic medications, but they can be very expensive. So you need to get insurance approval in order to prescribe it. It's often through a process called prior authorization, and then there's appeals, and then there's things called peer to peer, where I have to go on the phone with a representative from the insurance company to be able to justify getting a medicine covered. So I have a patient who was already on a biologic medication for a few years, and then the insurance company said, no, we are not going to cover this anymore unless it's given at home. It's a medication that has an increased risk of a severe allergic reaction to the medicine, so I only give it in my clinic under direct medical supervision once a month for that patient. And they were already getting it for a while and they were just not going to renew it. And so it went from multiple levels of appeals to finally a peer to peer where I talk with a physician for 30 seconds. And they had stated, well, you had documented that they weren't able to take the medicine at home because they had a tremor, which is true. But we want to verify that there's nobody else that's going to be able to give the injection for them. To which I said, they can't. They live alone. And I got the medicine approved, but this is an example of how it takes so many hoops to jump through and so much time and resources wasted just so that an insurance company can deny and delay access to care for a patient, which can be very, very problematic, especially given different contexts. I mean, it could be even potentially a life-threatening situation in some senses. Luckily for this patient, it wasn't a life-threatening situation, but it's still aggravating how much we have to do as physicians, as nurses, as people who are in the administrative positions in offices who are trying to do the best for their patients, but insurance companies put up these major bureaucratic roadblocks along the way.